Hi there. Welcome to Pharmacists Online. My name is Sumayya and I am an emergency pharmacist residing here in Saudi Arabia and working at a very well-known institute here within the kingdom. I am also the creator of the Facebook page Pharmacists Online. The aim of the page is to simply provide you, the public, with basic medication safety as well as pharmaceutical advice. So, if any of you out there have questions regarding medication safety, please feel free to post your questions on the wall of the Facebook page Pharmacists Online. Today's topic under discussion would be over-the-counter painkillers. Pain, throbbing pain, gnawing pain, headache, toothache, back pain, pain related to work stress. Pain, folks, is generally a fact of life. Fortunately, out there is medication that can assist us in resolving this misery. However, these painkillers have to be utilized correctly and under the correct circumstances. Now, how many of you out there, when experiencing pain, would simply go to the medication cupboard, would simply go to the first aid kit and remove painkillers available? Some of us utilize this medication over long, extended periods of time. Many of us out there are under the impression that painkillers are safe as we can purchase them at the pharmacy without the need of a medication prescription. However, folks, this is quite the contrary. In today's discussion, I would basically first run through a general idea of the classification of painkillers, and then I'd move into the side effects of these drugs. Now, analgesics or painkillers is basically drugs that are manufactured to resolve pain. How do these drugs basically work? These drugs basically work by simply blocking pain signals going to the brain or by interfering with the brain's interpretation of the pain signal without causing a loss of consciousness or producing anesthesia. When we talk about painkillers, they are divided up into two classes. We have non-narcotic analgesics and we have narcotic analgesics. Many doctors, physicians, pharmacists tend to also include the non-steroidal anti-inflammatory drugs, in short the NSAIDs, as part of pain treatment management. These drugs simply work by inhibiting the enzyme that produces prostaglandin, which is the key player in producing redness, swelling, inflammation that basically causes pain. When you talk about a non-narcotic analgesic, we basically talk about a common drug that everybody knows, paracetamol, acetaminophen. When we talk about narcotic drugs, these are drugs like your morphine, like your Tylenol with codeine, like your fentanyl. These drugs are strictly controlled and require the need of a valid physician prescription. I am not going to discuss this any further. We then talk about the NSAIDs, the non-steroidal anti-inflammatory drugs. These drugs initially came into the market to resolve menstrual cramps or period pain. We're looking at drugs like aspirin, ibuprofen, and various others like naproxen, ketoprofen. Now guys, through my work experience, I have basically found that a lot of these over-the-counter preparations are being misused and basically being abused. A lot of these over-the-counter preparations generally have clear-cut instructions stating that you should not utilize the drugs for more than 10 days if the pain does not go away. New research coming through basically indicates to us that even for a headache, painkillers should not be utilized for more than 2 days, simply because they cause a rebound headache. And this becomes a vicious cycle whereby the person continues taking painkillers, the body starts developing a tolerance to the drug, the patient suddenly finds he or she has a decreased tolerance to pain, and eventually the patient becomes psychologically dependent on these over-the-counter preparations. Folks, remember that when your body is undergoing pain, it's telling you that there is something wrong. So if the pain does not disappear within a reasonable period of time, it is imperative that you contact the physician, that you contact your pharmacist, and get help. Now, let's look at the side effects. Paracetamol, or acetaminophen, that everybody knows, believe it or not, is basically the active ingredient that is found in approximately more than 600 over-the-counter preparations. It can be found alone or even mixed concomitantly with other ingredients that are found in cold preparations, cough medications, as well as sinus medications. And a lot of the times you would find that a patient is taking a sinus medication, a cough medication, a cold medication, and they all contain acetaminophen, which means the patient is basically overdosing of the acetaminophen ingredient. Acetaminophen in high doses simply causes liver damage. I have seen this numerous times occurring where patients would come into the hospital taking an overdosage of acetaminophen. The way the damage is caused is that acetaminophen goes into the body, becomes metabolized, and produces metabolites that obviously need to be eliminated. But in higher doses, toxic metabolites are produced rather than eliminated. Looking at drugs like aspirin or ibuprofen or ketoprofen, these drugs, in terms of side effects, are taken in high dosages. They reduce the stickiness of blood platelets, resulting in stomach ulcers, resulting in internal bleeding. I've also seen kidney damage. I would like to point out to you that the NSAIDs, even at normal dosages, need to be taken with a full stomach and with lots of water. Also, if you're a patient taking warfarin or Coumadin or ginkgo biloba, you need to inform the pharmacist when taking the cephalins or the aspirins, because this exacerbates internal bleeding. The NSAIDs have also found to raise patients' blood pressures, has also found to either counteract blood pressure medication. Hence, painkillers taken for more than 1 week or 2 weeks or 3 weeks without any relief, you would need to consult with a physician or your pharmacist. I hope that this piece of information has been relevant to you, has assisted you, has helped you. For myself, Sumayya, wishing you good health. Join me again next time on another episode of Pharmacists Online.